things for me is the fact that we've obviously got Wi-Fi built in at Miranda House, which the initial kind of wired internet cable and data connections was done when we had less than a quarter of staff based in there, and all our estate is currently up to capacity on everything. And the traffic that allows means that Lorenzo and everything else runs slow. Everything we've looked at today, I have some concerns over how effective that will be in terms of efficiencies and those bits and pieces if we're not looking at the kind of the infrastructure that supports the wireless elements of it, really.
Okay. Do you want to go first?
Is there any plans to look at that kind of wired infrastructure?
Can I give a non-technical answer to that before I hand over to Lee, who might explain some of the technicalities around that? One of the sessions that I was on the tail end of earlier before lunch was there was one issue about laptops taking a long time to turn on, and there's an issue that myself and Lee have been dealing with recently, which is X-ray facilities in our community hospitals, and the bandwidth that it uses makes things run slow. So really what we need to be much smarter at and plan in much more is those technological advancements that happen quicker and quicker, that our infrastructure keeps pace with it. So making sure, if we are going to deliver on a lot of the things that you've been talking about all day, we need to make sure that our replacement programme keeps pace. So as new devices come onto the market, we've got a rolling replacement programme, but also the fixed infrastructure needs to keep pace as well. So the particular issue about Miranda House is important, but actually we need to have a whole system review to make sure that everything that's in place is continually reviewed and updated where necessary to deliver the new ways of working.
Adrian, if I can just add another, again, non-technical element to that. If the question is about, as we intensify the use of our built facilities, more staff based there, and potentially more staff using it as a flexible resource, are we going to keep pace with the investment? Well, the simple answer is it's got to be yes, because actually we need to reduce the amount of fixed assets that we work out of. We've got alongside the ability to scale up the technological solutions we want to deploy across the workforce, we've actually got to shrink the amount of estate that we're operating out of, because that's just an unsustainable level. So Adrian's right, we've got to keep pace, but we've got a real incentive to do that, because we know that a lot of the buildings we operate out of are not fit for purpose in other ways. Just the state of the building, their locations, or their cost just mean we can't do that. So we've got to find a way of delivering that investment to give us the flexibility in the assets we want to retain, so that you've got fit for purpose locations to work out of, but the reality is they've got to be fewer locations. And for everyone's benefit who was sat further back as well, the question was that if we've got a finite amount of resource, but lots of potential systems we could choose between, how are we going to stop ourselves spreading too thin? Again, other people can give a more technical answer to this, but in simple terms, we need to invest, first of all, in where we'll get the best return. Now, that best return might be a combination of productivity or quality, so we're either able to see more patients or support those patients better. So we need to make sure we've got good processes, so we're very clear wherever we're going to deploy the system, we're absolutely clear that it's the right place and we can articulate what the benefits are. The thing, and I've spoken to Lee about this before in relation to other projects, the thing that we then need to do for everybody else is we need to have some real transparency about that, so you can understand where you are in the queue. Because I think most people can understand that we can't do everything all at once, but too often we leave you unsighted and unknowing about whether if our capacity is to roll out 15 projects, if you're at number 16 you might be a bit frustrated, but at least you know that when we get some more time you're next. But if you don't know whether you're number 16 or number 60, then actually you've got no way of knowing. And the other part of that is, and I know that quite rightly many of you want us to limit the amount of communication we put out to you because you've got precious time, but we need to find some ways of keeping you better informed about how we've got on with the deployments we've managed so far, so you get the sense of, if it's not me yet, I can at least see how that benefit's spreading. But at the heart of the decision making has got to be, where are we going to get the real benefit in terms of the numbers of patients we conceive, or improvements in the quality of service we can offer to them. I think it's more than that in terms of the specifics, Lee.
It is. To be honest, we have a very skilled workforce. The issue is what the workforce does. Do we need to recruit a shed load of extra people? No. Do we need to potentially retrain and work differently? Absolutely, and that's part of where we need to look at the transformation programme and how we can change our skill set to be a more responsive and a more effective organisation rather than doing what we currently do. We don't need a shed load of extra people. What we might need to do is give people skills and support so they can do it themselves. And that's a slightly, not an unrealistic model, but it does create a different organisational development challenge than we have a very small group of very specialist people to actually have people that are empowered to do what they need to do. And not necessarily have to reference back too much to the centre when it's within your remit to do it as well. So, in answer to the question, but there is still the issue of capacity and managing the overall funding and the investment, which is a challenge we're always going to have. So it is the best bang for the buck situation.
Does it feel like it's been a productive use of your time? Well, it's mostly not. So, sorry, there's a shot on the microphone and the camera. So that's really useful. I mean, you've heard me say it before that we need to find ways of learning how to do our business differently. It's not just about adopting new technologies, but as Lee said, it's about using the skills and resources in the organisation differently. That's partly about finding ways of, improving our use of, champions and early adopters and people who can help teams to understand how they can refine their working practices better so that technology has more of a benefit. You'll have spent a lot of time talking through that. It's no use us redesigning the sort of the technological environment if we're still asking you to gather information that's totally redundant. So, the more that we can empower you to do that, but the major part is addressing how we get the engagement with you right, so that actually we're listening to the changes you want to see made. I mean, Lee made the point about making sure that we're getting things done at the right level. Part of the point of putting the new care group structure in place that we're working towards at the moment is to give you more confidence that actually decision making around things like changes to information gathering, decision making some of the pathways that the technology can then support. We need to get the approval processes for those much slicker, as well as getting more robust governance around them, and we can do that more effectively within the care group structure. Enough of you will have heard me tell this story before of an occasion when I met a group of OTs and physios last year who had been doing the sensible thing about reviewing the amount of information they were gathering at a first assessment of patients, and had redesigned the sort of the assessment process, had redesigned the documentation they were using, and submitted it for approval. And I'm ashamed to say, probably a year later, they were still waiting for someone to tell them whether they could change their practice or not. Now, that was just that it had got lost in a corporate organisation, and we need to try and find a way of making sure that doesn't happen. And if we can marry that, sort of a change in those corporate processes, the communication and the decision making, get that element right, and then map that against then adopting new technology that makes it possible to support those processes more effectively, then hopefully you'll all genuinely feel that this sort of process is worthwhile, because it'll translate through to less time spent on the data inputting and more time spent on the effective care for clinicians, and in the cases of some teams in particular, know who the patients are before you walk through their door. And something as simple as that has the potential to make a huge difference to your working lives. We know that, and hopefully you feel like today is a part of trying to get to that position and improve the way we get there.
I think as well, the key to the engagement is knowing that commitment's there from the top. Because having been around a while, I'm a bit sceptical now, because we taught digital pens, I don't know how many years ago. We've tried different mobile solutions that have not worked, but then you've never really heard the next bit.
No.
So things, projects have started and then stopped and disappeared or petered out.
And I think that's absolutely fair comment. And so, for those of you, and you won't be alone, I hear, as I go around the organisation, I hear lots of people tell me that's all well and good, David, but come on, we've been here long enough, and in the real world, and I can't promise you that we won't have some difficulties. And there are going to be some other conversations that are going to take place alongside all of this about what does an increase in productivity mean and look like. Yeah, and we will have different responses to that across the organisation and within individual teams. Some people will absolutely hold it hard to the notion that increased productivity can only mean more time in face-to-face contact with individual patients. Whereas other people will say, no, increased productivity means that we've got to see more patients and see them more quickly. And so, you know, there are discussions about that, you know, are still ahead of us. But if you're asking, is there a commitment to do this? Yeah, there absolutely is. You'll have heard in other places, we were very successful with an application for some external funding, so we know we have a pot of external money which is helping us to go further with this. But we've put the Trust's own money into resourcing, you know, other solutions that we'll want to roll out as well. In 1 year, that's not going to go far enough. There is a limit on absolutely how much we can spend in any 1 year. But we're not intending this just to be a sort of a quick 6 month, let's, you know, share out some laptops and some tablets and some digipens and then forget all about it. This has got to be part of a sustained programme. You all know, you don't need me to tell you, the numbers just tell us that that's what we've got to do. And I don't just mean by the numbers of the money, you know, the numbers are the numbers of patients who require our care. And you know, the simple truth that being patient focused means worrying about the patients we haven't seen yet as well as the patients we have seen yet. And you know, using technology better, transforming some of the work that we're able to deliver because of that technology means that we can meet that demand of those patients that as yet are either on our waiting list or are unknown to us, as well as improving the services to the patients we're already in contact with. But yeah, every right to be cynical until we get there. But you know, what I'd encourage everyone to do is to focus on the benefit of events like today. If we can design the right solutions and work with you to make them successful, there's more chance they become embedded, which means there's more chance of it becoming a sustained programme. Can't believe that's really it. I'm just trying to work out whether you've passed my golden rule of meetings, which is no one gets to leave until I've been asked an interesting question. But I reckon we've had some interesting questions. I don't know if Adrian or Lee want to say anything else. I mean, I opened the day by thanking you all for giving your time up to be here. And I just want to thank you again for your contributions and participation today. And hopefully you really do feel like it's worthwhile, and hopefully if we get back together at some point in the future, you'll think that not only was today worthwhile, but we actually have started to deliver something consequently that helps you do your jobs better. Lee, is there anything else?
Not at the moment. I'll probably hand you over to Adrian.
Yeah.
Who's going to do the closing.
I think all I wanted to say, in addition to what David's just been through, is thanks to everybody for giving up the time today. We had two primary objectives of the day. One is for the team to share with you some of the work that we're doing, some of the technologies that are available, and I hope you found that beneficial. But for us, the other thing that we were looking for is feedback from yourselves. So we've had various sessions through the day that have been facilitated, and John and others have gathered that information that we can start to look at some priorities and themes. We've had the boxes with the suggestions in there that I hope you've had the opportunity to fill in throughout the day. And if I could ask that you all fill in your evaluation forms, because when David asked the question, was it worthwhile, I think we were broadly seeing nods and positive faces around the room. So the question will be, when should we do this again, and what can we learn from today to improve it? So please fill your evaluation forms in. I'd like to say thanks to the various organisations that supply us with services that have come along today to either demo or help with the sessions. They have all provided things for goodie bags, but my understanding is you don't get your goodie bag until you fill your evaluation form in. So I think they've been hidden away for now. I don't think they've stretched to bags full of iPads and other goodies, but I'm sure you'll find some useful stuff in there. Sorry? I think you should give yourself a round of applause, and the suppliers who are at the back of the room would be really helpful. So thank you very much.